Thank you for joining this presentation to find out more about the Centre for Human Factors at the University of Hull. We're going to talk you through how the Centre was formed, our capabilities and who we are, why employers should invest in mental health, the health and safety approach to occupational stress risk, and our commercial success. The Centre for Human Factors was formed in July 2019 by Professor Fiona Earle with the main business aim of providing high-quality human factors and occupational psychology consultancy and applied research, underpinned by the rigour and ethics of an academic institution. The team has established a reputable service portfolio of evidence-based approaches to health, safety and well-being in the workplace. We've collaborated with the UK Health and Safety Executive to deliver research and consultancy that aims to address a range of issues of importance in the workplace, including stress, fatigue, trauma, and to develop existing occupational stress risk assessment tools and approaches. Our vision is that all employees know how to have a healthy work life and can make informed choices about how they work, and that all employers make it the employee's right to work healthily and support them to do so. Our mission is to work with employers to reduce work-related stress, anxiety and depression to its lowest ever levels and make work a place of health. To do this, we help organisations understand and effectively manage risks to health and well-being in the workplace. I'm Dr. Katie Cunner and I'm a psychologist and operations director at the Centre for Human Factors, and I work alongside Professor Fiona Earle, Chartered Occupational Psychologist and Director of the Centre, and Dr. Steffi McMaster, Psychologist and Postdoctoral Researcher. And we're part of a much larger team of consultants and associate consultants delivering work on behalf of our clients. Our capabilities and skills include the fact that we are chartered psychologists with over 40 years combined experience across occupational psychology and mental health in the workplace. We work collaboratively with the HSE to support organisations in meeting their legal duty of care, and we're applied research specialists, and our specialist area is in stress risk management and fatigue. We utilise robust and defensible systematic methods of inquiry, and we develop evidence-based findings. We prioritise preventative approaches and root cause analysis, and we also deliver testing the success of workplace interventions end to end. We develop bespoke solutions for organisations, and we have methods versatility with our data collection. We also work with senior leaders to explore findings and develop action plans that underpin policy and strategy. Our main areas are in fatigue risk management and occupational stress risk assessment, bespoke training solutions, trauma and resilience, and assessment and selection. So why should employers invest in mental health? Employers have a legal duty of care to protect workers from stress at work by doing a risk assessment and acting on the findings. According to the Health and Safety Executive, an estimated 828,000 workers were affected by work-related stress, depression or anxiety in 2019 to 2020, resulting in an estimated 17.9 million working days lost. Mental health problems in the UK workforce cost employers almost 35 billion last year. By far the largest part of the business cost is in the form of reduced productivity among people who are at work but unwell, known as presenteeism. This costs businesses twice as much as sickness absence relating to poor mental health. A recent Deloitte report suggested that the details of the economic cost to organisations who have employees suffering from mental health problems show that this costs businesses £1,652 per head, compared with £1,716 in the public sector. In addition to the business case and the legal case, there is also the ethical case that good work should do no harm and at very best be a place of health. It's interesting to note that 50% of new and long-standing cases of ill health last year were due to stress, depression and anxiety. and that 70% of new cases of ill health that were caused or made worse by the pandemic were stress, depression, or anxiety. The Health and Safety Executive and the University of Hull advocate for the health and safety approach to occupational stress, parity of esteem between physical health and safety and mental health and safety, and approaching it in the same ways. Organisations can benefit from a range of interventions which address stress risks, as well as offering support to people in distress. Our focus is on primary interventions which aim to identify and manage the root causes of stress. Many organisations at present are focusing their attention on tertiary and secondary interventions. Tertiary interventions are those that treat somebody once they've become distressed, so once the harm has been done. So this might be something like counselling or mental health first aiders. Secondary interventions do have a preventative element and they can help to develop resilience in teams. However, they might be workshops on coping strategies or increasing resources for individuals, but these do tend to focus on the individual and building them up to cope with whatever's thrown at them. What we're really interested in is this primary space, which tends to be lacking across the board at the moment, which is that proactive, preventative strategy, looking at the root causes at an organisational level, not the individual level, the organisational level, by doing a risk assessment. This is the request by the Health and Safety Executive, is that this takes place at the organisational level as a risk assessment of stress, and then acting on the findings of that risk assessment. What we're not saying is that the primary intervention is the one that people should be focusing on. We're saying that there is a need for all three levels of intervention, but at the moment, the primary space is the one that's largely lacking across the UK. This aligns our approach to dealing with stress, well-being and mental health with the standard health and safety approach to managing physical risks in the workplace. So the requirement is that you do a risk assessment based on root cause analysis of organisational factors, that you act on the findings, and that you monitor progress. Our team works with organisations to support them through that process, to undertake risk assessments, and to also include, alongside the existing materials provided by the Health and Safety Executive, the Management Standards Indicator Tool or the Stress Indicator Tool, which is available digitally online. We facilitate that process, but we also help to undertake bespoke stress risk assessments, which includes exploring contextual organisational factors. So working with employees across an organisation to understand those risks that might be bespoke to their individual context or unique. This is particularly important in high-risk environments or in environments where there's significant chance of exposure to traumatic incidents, such as in social work, policing, and other high-risk contexts. We've applied our methodology to a recent project, so just a brief case study example, the Future Work Design project, which has been delivered within local authorities. Working with local authorities in our region, so East Riding, Hull City, North Lincolnshire and North East Lincolnshire councils, we developed an award-winning remote working stress risk tool, and this is now available via the HSE as part of a suite of recommended stress risk management tools. We've worked with a range of organisations, including a number of local authorities, policing organisations, onshore and offshore wind, and renewables and oil and gas. And we wanted to just provide a few client testimonials, so we'll leave this here for you to have a read. Our main sectors are local authorities, policing, fire and rescue, control rooms, offshore wind, onshore wind and higher education, but our methods are applicable in any sector and we'd be very happy to have a conversation with you. Thank you for joining this presentation to find out more about the Centre for Human Factors and how we work. If you'd like to get in touch with us to discuss how we could help your organisation, you can use the email address or contact details on the screen, or you can use the Contact Us page on our website.